Being care experienced is, for me, a superpower. It's shown me that I'm adaptable, empathetic to others who have gone through similar circumstances, and resilient in the face of challenges.
Today is designed and co-produced by the experts by experience, so they're in charge. And when we planned this event, the experts experience said, we want people in the room who have power to make change. We want academics, we want the Department of Education, policymakers, we want trustees, we want influential members of the sector.
The NCB living assessments and experts by experience are a key part of the journey. You're a key part of where we've come from, and you're a key part of where we'll keep going. So I'm really looking forward to keep working together on improving the lives of children and young people and families. So thank you for having me.
I call on you here today to reflect on your working practices and consider if they are neurodivergent friendly and inclusive to all.
I just wanted to be humble and enjoy those experiences.
So what do we want to change? We want better training for social workers to understand the social model approach.
We need better access to housing support, mental health care, education and job opportunity.
And I'm so grateful to have the opportunity to meet other people who are part of services that actually want us to speak.
And I believe it's up to the people in power to decide wisely, carefully, knowing how delicate they are, how they want that potential to be realised. Thank you.
Because it's a partnership between academics, people with lived experience, as well as then the National Children's Bureau, where we're really thinking hard about how can we use anything that we find out during this programme that will influence policy and make change really happen. That's been like a fantastic combination.
I think this has been an absolutely awe-inspiring project, and this is mainly because of our ability to facilitate our experts by experience. And I think that they are so central to the project, and we designed this project with them in mind. And then they came forward and we co-produced and co-directed the project. So that is why I think it's so unusual normally for a research project.
We put together something that was a bit unique with policy engagement baked in from the very start, with experts by experience shaping the project from its very design and thinking at every stage about what were the priorities, and being involved also in the dissemination and shaping how we were spreading words of our findings.
And so we know already that it has fed into policy that is being implemented right now. So even things like pieces of legislation, so the big piece of legislation going through Parliament at the moment has got aspects of this programme already wrapped in it. And that's an amazing achievement.
And so today feels like a real vision that they've seen and created and exactly what they wanted. And I'm always just bowled over by their bravery and courage to stand up there and share their personal difficult experiences in such an open way, and their huge commitment to making sure change happens for the next generation.
I didn't think that I would have the opportunity to actually speak to researchers, people who cared enough to want to make a change and had the ability to do that on a governmental level, policy level, and actually hear from us personally.
Fundamentally, all of you told us that you don't want other children and families to suffer the same traumatic experiences, and therefore the system must change. Thank you to our experts by experience for your commitment to improve the lives of the next generation of children and families experiencing the social care system. We couldn't have done it without you. Thank you so much.
And I would hope that this day will inspire other academics perhaps to think more about the way we do our research, how we involve people with experience, and generally move towards better and more relevant research in the future.
We won an award from the University of Cambridge, the Impact and Engagement Award, which is the highest award from the university for impact. That is to say, of all the research taking place at the University of Cambridge.
I feel so emotionally invested in this project in a way that I'd never felt about a research project before. And I think that's because of the people.
It's been a new chapter for my career to have such depth of involvement from experts by experience. thinking together about what the priorities are for research and policy engagement. And today's been a celebration of that. It's been wonderful.
It's been such an incredible experience to actually get to meet other disabled young people, to work on policy and campaigns pertaining to children and young people, especially disabled children and young people. And I think it's given me a platform to understand myself, to build my confidence and to realise that actually I have such potential.
So the initial idea came out of some conversations we had with our experts by experience in earlier meetings, where we talked about stigma and the impact of having the care label attached to you. We were inspired by that as a starting point. So that was where we thought, what can we do that would challenge narratives for children and young people with care experience or disabilities? And what methods could we use? So that was where the theatre workshops and the online art gallery were initially kind of started as an idea. And I think what struck us is just the incredible passion and imagination that children have and can convey in a way that's much more safe than traditional research methods, and it enables us to learn as policymakers and researchers in a different way in comparison to traditional research.
What we're trying to do is capture their thoughts in some form of creative expression of lived experience barriers and hopefully ways in which our young people have got around those barriers. It's a combination of free expression created into different monologues and stories, songs. What we've then done is we've tried to get that sense that a lived experience shared is a possible barrier halved.
So my performance is based on a rap that I made. I work as a trainee here, and it's very rare for people like me to go and get those opportunities, so it's something that I strive to do. I'm doing it because I want to make people heard.
It's been really nice to work with people, different people and of all different disabilities. So the story is about having struggles that are not really spoken about. If we don't spread awareness, how will the world change and grow?
I like things that that I can give some sort of message, that that inclusion and also like hope and faith. I think what I've learned is probably the maturity in terms of like creating something, and in terms of like confidence as well. Art for me is it's a thing where it's undescribable with different emotions, different way of communicating.
I wrote it myself, and it's about the freedom that I found getting the opportunity to go to dance classes and the freedom to move and express myself. That really made me who I am, and that's why I wanted to tell that story, because I could easily talk about my autism and my experience in education in a really negative way and make it really sad, but I don't see myself as a sad person. I don't see my story as a sad story.
So we are telling every single story.
Happy, really happy. I'm proud of all of us, what we've done.
It's really nice to express who I am. I'm really glad hopefully people will walk away happy and liking it.
Impeccable. I think it got the message across in a really nice way.
And especially as a person living with autism as well, I can relate to some stuff that's been said there, and yeah.
It was so powerful, like so wonderful to have young people's voices like front and centre, but also expressing it in whatever way they wanted.
Seeing the phenomenal change in my little boy because of the support that he's received from NCB. Today is a model of what the future world should look like.